Dr. Gannon, appreciate your time. As the former AMA president, you know better than most about how governments operate and how they interact with the medical profession in this country. The government stresses, of course, it's heeding the advice of the chief medical officers around Australia. Why then are we seeing medical professionals calling for much stronger action than official government advice suggests? Why the disconnect?
Well, we certainly know how hard everyone's working, whether that's the federal government, the state government, their bureaucracies, their health advisors. But what frontline clinicians have been telling them is that they're not acting quickly enough. Sometimes we see a reluctance from government and the bureaucracy to listen to the profession, to listen to the AMA, and sometimes that delay in acting has given this virus the opportunity to take a foothold. So it was out of sheer frustration that frontline clinicians through the AMA and through other channels like social media are crying out, saying it's time to act. Slowly, we're seeing our political leaders start to comprehend the sheer scale of the threat.
The letter you signed warns of the need to urgently source more ventilators, more personal protective equipment and medical supplies. We have just in the last hour heard from the Health Minister on this front. He says that the government is aiming to double ventilators in this country from 2,000 to 4,000. He spoke a lot about an extra number of masks that have arrived. They are expecting an extra 30 million masks in the next fortnight. The doctors, though, that I've been speaking with are very worried on that front, that we'll run out of ventilators, that there isn't enough equipment. What is morale among our health workforce like right now? How worried are they?
Well, doctors, nurses, other healthcare workers are very worried. The nature of our communication networks is that often a lot of us have professional relationships with colleagues in other parts of the world. So in recent days, I've spoken to a colleague who works in the intensive care unit, talking to their colleagues in Korea. I've been talking to friends and colleagues in Britain, who in turn have close connections with what we're seeing in Italy. So the nature of those networks is that frontline doctors across the world know people, they know the scale of the threat. The countries that are doing best at the moment, Singapore, Hong Kong, Taiwan, they've learnt from the experience of SARS 15 years ago. We need to listen to them. We need to learn. Slowly but surely, the urgency of the situation is being grasped by our political leaders. And I'm delighted to hear news about that equipment potentially arriving on Australian stores. Minister Hunt, the Morrison government have done a good job with the telehealth item numbers. I'm glad to hear they recognise that other measures are going to be required. This is only the beginning, and slowly but surely, day by day, everyday Australians are starting to comprehend the reasons why doctors are so worried about the COVID-19 pandemic.
What changes are we already seeing in terms of elective surgery and with your own specialty of obstetrics, how are maternity services being impacted?
So when it comes to elective surgery, we've already seen some certain high-risk areas cut, and they need to be cut. We welcome the news that there's more personal protective equipment being made available, but as long as we've got GPs attending residential aged care facilities without gowns, masks, gloves, when we've got hospitals that are down to 2 weeks of supply, we cannot in good faith continue to do elective work. Now, some hospitals have already cancelled elective work in high-risk specialties, and I mean high-risk in terms of healthcare workers getting infected, like ear, nose, throat surgery, like dental surgery, like eye surgery because of the close proximity to the patient. And those of us who work in other areas of non-urgent surgery seriously need to think, can we, in good faith, use up a gown, a mask, a pair of gloves that might save a colleague's life, that might save a nurse's life in 3 or 4 weeks' time. When it comes to maternity services, they need to continue. So the ability to take care of pregnant women, to take care of their babies, and to continue to provide those services when we are going to see nurses and midwives get sick, when we're going to see anaesthetists and obstetricians get sick, where we're going to see people afraid of going to hospital, where we're seeing them get mixed messages about what is essential and what's not essential. It's a very difficult environment. Slowly but surely people are coming to the realisation that this is a once-in-a-lifetime threat. But if we don't cut hard and we don't cut early and we don't get very serious about quarantine, about isolation, we are going to see a catastrophe in Australia. This is not life as we know it. Those changes need to start happening, and they need to start happening today.
Dr. Gannon, just finally, we've seen long lines around Australia as people queue at Centrelink offices. What are your concerns when it comes to the health impacts of unemployment? We know they could be massive.
There are massive mental and physical health consequences that are going to come out of this epidemic. There are people in every single industry that are affected by this. Now, we might see some green shoots in the manufacturing industry as we find the ability and the skill to make ventilators, hopefully, to make personal protective equipment. There are some industries that remain essential, like utilities, like the internet, like the healthcare industry. But we have to steel ourselves for unemployment rates of 10 to 15%. That's going to have consequences. So we need to look out for each other. We need to be kind to each other. We need to support each other. We will be defined as a nation by how we respond. We'll be defined as individuals and communities by how we look after each other in this unprecedented threat. It is a war. We need to look after each other. But we need to make those changes, and we need to make them today, tomorrow. We need to make them before the end of this week.
Dr. Michael Gannon, good advice. Appreciate your insights with us on Newsday. Thank you.